Welcome to Better Than Ever Live, wherever you're watching, wherever you're listening. I hope you're making today your masterpiece. In this video, we're going to talk about the health benefits of coffee. We're going to look at health measures, health metrics like high blood pressure, cardiovascular disease, different forms of cancer, effects of coffee and caffeine on the brain, and development of neurodegenerative diseases like Alzheimer's, and touch on possibly some concerns and side effects to be aware of with coffee. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical history. Now, please understand, I am not giving you medical advice. This is meant for general information and educational purposes only. Now, as I always say, if you have comments, you have questions in this live stream, I definitely want to hear those. I'd love if you have thoughts about coffee and various other things that we're going to talk about. Hey, Robert, glad to see you here. I'd love it if you don't mind. I'd love for you to give your first name, hopefully where you're located, along with your comment or question. If you do have thoughts on, or maybe questions about some medical orthopedic injuries, you could leave those as well, but I'll get to those comments at the end. All right, I want to start by talking about how common coffee is. Coffee is one of the most consumed, most drank beverages in the U.S., second only to water here in the U.S. We drink 400 million cups of coffee every day, 150 billion cups of coffee a year. Now, the age group that drinks the most coffee are the old people, 70 and older. Older adults drink over 2 cups of coffee a day, but young adults are right behind them, between 25 and 29 years old. They drink over 2 cups of coffee a day. In terms of race, Hispanics drink the most coffee. Men versus women, it's hard to say. Some studies say women drink more, some say that men drink more. So that's pretty close. Now, if you're like me, you drink coffee as a pick-me-up. Stimulant boost from the caffeine, obviously. And over the last few years, and we've talked about it a little bit in these videos, we've seen more and more studies talking about the health benefits of coffee. And it makes sense, right? Coffee is a complex beverage. It has all these biologically active compounds. Like, talk about some of the health benefits. And we've got to start with the one that gets the most press, and that's cancer. Now, years ago, there was this assumption that if you drank more coffee, you had a higher risk of cancer. Turns out that's not true. Now, coffee drinking is associated with a lower risk of liver cancer, lower risk of oral and pharyngeal cancers of the mouth and throat, lower risk of endometrial cancer, lower risk of colon and rectal cancer. But if you look at some of the other studies, coffee's really neither good or bad for a lot of the other cancers: stomach, pancreas, lung cancer, breast cancer, ovarian, prostate, but still good for a lot of types of cancer. Now, what is it about coffee that leads to these cancer benefits? Well, it's actually not thought to be the caffeine, but it's got a lot of compounds like polyphenols that block some of the oxidative processes in the body. So that's probably the good. But coffee does have acrylamide, which in theory might have cancer-causing effects. Now let's look at the heart and cardiovascular disease, because with coffee, that's what you typically think of. Coffee is somewhere between neutral, no effect, and actually beneficial for a variety of cardiovascular events: coronary heart disease, congestive heart failure, abnormal heart rhythms, and stroke. And there are some studies, large epidemiology studies, that show that coffee drinkers, people that drink it on a regular basis, actually have a lower risk of death, either from cardiovascular disease or from any cause. Now, how much can you drink? Well, we're going to talk about how much can you drink for all reasons later, but specifically with the heart, drinking between 3 to 5 cups of coffee a day actually seems to be associated with a lower risk of cardiovascular disease. And if you drink a ton, 6 cups of coffee a day or more, which sounds crazy, doesn't seem to have an effect on cardiovascular disease. Now, diabetes linked to cardiovascular disease, coffee has been shown for years to actually have a good effect on type 2 diabetes, especially if you drink a lot, 6 cups of coffee a day, 33% lower risk of type 2 diabetes. But over and over, studies have shown that coffee has what is called an inverse relationship with type 2 diabetes. Basically, the more you drink, the lower your risk of type 2 diabetes. And more than the caffeine, it's actually the polyphenols in coffee that are thought to be good for diabetes. Now, liver disease. We talked about liver cancer, but more and more studies have shown that coffee is good for your liver and prevents or slows the development of a lot of types of liver disease, like hepatitis B, hepatitis C, non-alcoholic fatty liver disease, alcoholic liver disease, hepatic fibrosis, and cirrhosis. Very, very dangerous medical problems, so that's good. All right, high blood pressure. You'd think, all right, if you drink a lot of coffee, caffeine's a stimulant, that's going to raise your blood pressure. Well, maybe not. There was one study out of China that shows what's called an inverse U-shaped association. Basically, if you drank less than 1 cup of coffee a week, or barely any at all, or more than 3 cups of coffee a day, that was better for your blood pressure than just drinking 1 cup of coffee a day. Now, since then, what we're seeing is, again, that inverse relationship between coffee this time and high blood pressure. It's sort of a dose-response thing. Basically, your risk of high blood pressure drops 2% with every cup of coffee you drink. So if you drink 1 cup of coffee a day, you lower your risk of high blood pressure 2%. Drink 2 cups of coffee a day, lowers it by 4%. And you got to talk, when you're talking health and coffee, you got to talk about the brain. There's a lot of positive benefits between coffee and caffeine specifically and the brain. It seems to increase or augment the effects of analgesic drugs, pain relievers for headaches and migraines, not associated with seizures. And best of all, caffeine and drinking coffee seems to prevent cognitive decline, reduce risk of strokes, reduce risk of Parkinson's, reduce risk of Alzheimer's disease. And if you drink any cup of coffee at all on a regular basis, you know coffee makes us happy. Over and over and over, studies have shown that drinking coffee is associated with a lower risk of depression, and it's the caffeine in coffee that's thought to have the antidepressant effects. Now, here's a realistic question. Does it matter regular versus decaf? And there's a lot of studies I found that decaf coffee actually has pretty much all the same benefits of regular coffee. So it suggests it's actually not the caffeine, but it's something else like the polyphenols that make coffee healthy. Now, when you're talking about an addictive drug like caffeine, we've got to talk about side effects. And again, this is because of the high caffeine content in coffee, but things like anxiety, insomnia, headaches, heart palpitations. In women, it can increase the risk of bone loss and fractures. And during pregnancy, drinking a lot of coffee increases the risk for a low birth weight baby and preterm labor. So how much coffee can you drink, or should you drink? This is sort of the bottom line, right? Because we all drink coffee. And for most adults, 3 to 4 cups of coffee a day, or 300 to 400 milligrams of caffeine a day, really no risks, but lots of health benefits. But you gotta watch out for places like Starbucks where they jack up the caffeine in the coffee. Just a tall coffee, 12 ounces at Starbucks, 260 milligrams of caffeine. The grande is 330 milligrams of caffeine. So in one sitting, it looks like, according to research, you can get about 200 milligrams of caffeine, or 2.5 cups of regular coffee you brew at home. Over the course of the day, 400 milligrams of coffee, or 5 cups of coffee a day. Now, one thing that I really want to point out, all the studies that I talked about, the health benefits of coffee, this is all based on observational data, not randomized control trials. And honestly, correlation doesn't equal causation. It could be that the health benefits of coffee, it's associated with them, but it's not causing the health benefits. And then I want to wrap this up before we get to comments and questions. I want to talk about something that just happened to me the other day. I was at a coffee shop. The guy in front of me in line ordered the light roast coffee. He specified the light roast and not the dark roast because it had caffeine. Now, granted, it was 4 o'clock in the afternoon. He was addicted. So here's something I tried with coffee. You might think about trying it on your own. I used to drink 4 to 6 cups of coffee a day. Sometimes I'd even use caffeine pills, and I knew I had to get that under control. So I worked at it, got it down to 2 cups of coffee a day, got it down to 1 cup of coffee a day. But a lot of the health experts that I follow talk about taking days off of caffeine completely. So I alternate between regular and decaf. Tuesdays, Thursdays, Fridays, 1 cup of caffeinated coffee. The other days, decaf coffee. And what I found was really, really amazing. When I got down to 1 cup of coffee a day, the days that I only drank decaf didn't really bother me if I drank a lot of water. But after a day or two off of caffeine, that next day when I had regular coffee, just 1 cup of coffee, I'd get this huge surge of energy, better focus, better concentration, better mental performance. If I had been working out, I would have seen better athletic performance in the gym too. I really believe that generally we all drink way too much coffee. So we've gotten tolerant to all its effects. We don't get that stimulant boost because our bodies and brains have become used to it. So try that as a strategy if you want. You might see some benefits. So that's really my thoughts on coffee. If you have comments about coffee, about caffeine, I'd love to hear those. Otherwise, I'll go ahead and wrap up. But I love coffee, but I do try to limit it to no more than 2 cups of coffee a day personally. I know that there's some benefits to doing a little bit more than that from a health standpoint. I personally try to keep it to 2 cups of coffee a day or more, but maybe that's not for everybody. So it's just something to think about. And I know I mentioned a lot of studies in this video, and if you want to read those yourself, I've put the links to those in the description below that. And as I like to say in these videos, if you want more information on health and wellness, healing, recovering from orthopedic injuries so you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel. Click the bell to be notified of any new videos, but any new live streams as well. And if you have an orthopedic injury, tendon, ligament, bone, cartilage, muscle, joint, doesn't really matter, and you want to see somebody that knows about musculoskeletal injuries in athletes and active people, I would love to help. I'm a double board certified orthopedic surgeon, sports medicine specialist. I'll talk to you about all your options so that you can recover from that injury, hopefully not just talk about cortisone shots and physical therapy and surgery. So go to my website, drdavidgeier.com, go to the contact page. You can make an appointment to see me, the link to my website, and the contact information at the top of my website. The links to those are in the description below this video. Again, I'm Dr. David Geier. Thank you so much for watching, and I look forward to helping you feel and perform better than ever. And one last thing, just real quickly, for Thursday, I'd like to kind of do the same kind of discussion. What I'm planning to do, like I did health benefits of coffee, and I spent a lot of time researching this because I wanted to dive into one topic. Thursday, I'd like to do one on the role of sleep and athletic performance. I got a little trick with my schedule that there's a chance I'm not here Thursday, but that's the plan, to do it Thursday. I will definitely be here Friday for Ask Dr. Geier Live, so for what that's worth. I drink so much coffee, black coffee, I'm not always feeling good. I get dizzy, nausea. So unfortunately with coffee, that's a side effect of the caffeine. If you drink a lot of it, especially on an empty stomach, it can cause nausea and some people's stomach pain, heartburn, that kind of thing. So there's 2 ways to go with that. May not be super popular. One, though, would be to drink coffee with food. Try that. Another one would be alternate maybe regular and decaf coffee, or worst case scenario, maybe cut back on the coffee. All right, and like I said just a few minutes ago, if you know people, if you like videos like this, definitely subscribe, click the bell to be notified. But if you know people that like health, wellness, aging, nutrition, exercise, definitely tell them about this, have them join us, have them follow. I'd love for more and more people to find us, to comment, just more discussion. Also, remember to subscribe to the podcast, Better Than Ever Live, wherever you get your podcast. Thank you so much for watching, and I look forward to seeing you right here next time.